Assalamualaikum. John Hopkins Chesney Archive is a medical archive website that functioning to preserve the historical record to the John Hopkins medicine, nursing and public health in order to have further research for ongoing operation, teaching process and publication. In the 1930s, Alan Mason Chesney, the Dean of Johns Hopkins Medical Faculty, proposed on collection of historical record. The vision for Chesney Archive is to develop the archive program as a major center for the advancement of knowledge in the health field. This means the archive want to be the center of resource for public and students to find information. The mission for Chesney Archive is to dedicate it to setting standard of excellence archive in the health field, and for the Chesney Archive in particular, their commitment is to document the history of Johns Hopkins medicine and nursing and public health to provide access to the material collection.
Thanks Ain, Assalamualaikum and good day to Madam Jen and my colleagues. I am Ameerul and I will be presenting on the activities of the Chesney Archives. I will start off with acquisition and collection. What is acquisition? Acquisition is the process of identifying and acquiring by donation or purchase historical materials from sources outside the archival institutions. The Chesney Archive acquires the collection of materials through donation and contributions from the people associated with Johns Hopkins and Johns Hopkins Medicine, Nursing and Public Health. Sources of funding of this archive come from core support, donations from major individuals and grant support. Next is collections. The Chesney Archives is home to a wide range of collections, from personal papers and institutional records to photographs, audiovisual materials, fine art, and artifacts. Due to funding provided by J. Mario Molina, the archives is able to expand digital access to the collections in every collected area so that they are easily accessible for reference and research. There are 6 types of collections at these archives, and they are art and artifacts, audiovisuals, biographical, institutional records, personal papers, and photographs. The second activity of these archives is appraisal and disposition. I will explain on the appraisal part first. Some records created by Johns Hopkins Medicine, Nursing and Public Health warrant permanent retention because of their enduring administrative, intellectual and historical value. These archives assist with identification, transfer, preservation and access to these records, and this evaluative process is known as archival appraisal. It is the responsibility of these archives for the permanent archival preservation of core and critical documents relating to the administration of Johns Hopkins Medicine, Nursing and Public Health. When they are no longer in active use, Johns Hopkins has established standards for the retention of business, administrative and financial records based on generally accepted accounting practices, legal and regulatory compliance. The Johns Hopkins University is required to retain the university records for a specific period of time pursuant to legal and institutional requirements. Proper managing and disposing of such records are the responsibility of the entities and people receiving, creating and using the records. This is subjected to policies and procedures of the university, division and unit, schedule of records, retention of the university and applicable laws and regulations. The disposal of the university records includes the following action, such as to maintain such records permanently by the responsible party after consulting the appropriate archives or as per policy's requirement. Next, to transfer to the archives for records with enduring value. Lastly, to dispose such records with no value or no requirement for permanent retention by regulations. That's all for me. Thank you.
There are some exceptions. The Chesney Archive have been involved in order to keep all the records for Johns Hopkins Hospital. Chesney Archive is also responsible for assist Johns Hopkins Hospital in record keeping, especially when the hospital is involved in collaboration with other hospitals to perform a major surgery such as breast cancer surgery. Other than that, Chesney Archive also involved on keeping all of the records of Johns Hopkins Hospital when they are performing a big surgery. And the records that been kept by the Chesney Archives is one of the advantage of Johns Hopkins Hospital, as it has a record that are unlikely to be lost and also fragile, but are kept neatly by the archive for the future reference.
In archival institution, there are levels of arrangement used in archival work. For the diagram, we get to know that the group is School of Medicine. Group is the primary division in the arrangement of record and archive at the level of independent originating organization. Next, the series are Alan Mason Chesney Collection. It is the level of arrangement to the files and other record of an organization or individual that bring together those relating to the same functional or activity. Then the subseries from the diagram is correspondent 1905 until 1966. Moreover, the file is correspondent between Alan Chesney and Lewis Witt 1929 to 1945. File is an organization physical assembly of documents grouped by together for current use. Last level of arrangement is item, and the item is alumni scholarship School of Medicine 1991. Description is a process explaining the execution, analysis, organization, and documentation of record or information. From the finding aids of Alan Mason Chesney collection, there are information about the archive material. It is to provide knowledge and information about the archive in the level of group and series. There are also indexes that highlighting the creator name, dates, scope, and call number.
I will continue the presentation with the topic of preserving and storage. Preservation is the process of preserving cultural property by minimizing chemical and physical degradation and destruction and preventing the disappearance of informative content. In the Johns Hopkins Chesney Archive, they preserve materials that are critical and devoted to preserving materials of Johns Hopkins medicine, nursing, public health historical record so that it can be obtainable for current operations, teaching, researching, and publishing. The archive also collected and preserved records relevant to the history of Johns Hopkins medicine, nursing, public health, and all the people who have contributions related to it. The type of materials that are being collected and preserved are in both digital and analog formats. In order to preserve materials in the archive, precautionary measures are taken to handle and access those materials, such as using gloves when necessary to prevent the disappearance of information, handling one box and file at one time, and start a call slip showing that the materials reviewed. Storage and archiving is the activities where all or portion of the data captured about a critical event is saved digitally or in the physical copy. The Johns Hopkins Chesney Archive has several types of storage in storing their materials due to the reason they have several different types of collections. The type of collection in the archive include biographical files, art and artifact collections, photograph, audiovisual collection, personal papers, and institutional records. Most of the digitized collections are stored in database, while the materials that are not digitized need to schedule an appointment with the archive to view it in the reading room. Finally, they also use off-site storage facility for materials that need to be kept for a lengthy time.
Okay, will talk about the access and the reference service that provided by the Chesney archive. So as you can see right here, when you access to the Chesney archive, you can get the information easily. The website provide a link of the originality of some information records, and this website is also can be accessed by the public because it is a public figure or the public website that can be accessed by the others. So when you access to the Chesney archive, you can access to the collection there, the archive head, the guideline for the user to do the archive things, the shows and event that the archive do, and you can also access to the research and to the research resources. After that, the Chesney archive provide a reference service. So the reference service that you can see inside it is you can search information by the online catalog, you can direct message to the client, and you can email it to the archive. So I will talk about the first point, which is here you can searching information by the online catalog, which is you can search the information record by using the keyword or the category of the information record. The direct message to the client, which is here, you can text the client by text message using the phone number that provided there, and you can email it to the archive, which is the Chesney archive also provided the official email, so you can ask the question to the client that working at the Chesney archive.
Outreach activities. According to European Commission 2020, outreach activities are designed to attract a broad community and provide information and expertise on specific issues to the broader audience. Among the outreach activities conducted by the Johns Hopkins Chesney Archive is by holding exhibits. The exhibition run by the archive is through a visual exhibition. It can be accessed and viewed through their website. There is so many exhibits that are already conducted by the archive, such as past exhibits which are Rusty Bartlett, William of the Photo Album 1902 until 1903, and many more. As for future exhibits are such as the Baby Blue Operation, the Portrait Collection, Hopkins and the Great War, and many more. Last but not least, another contribution from the archive is publication. In 1980, Johns Hopkins Chesney Archive published a scholarly book involving research. The title of the book is Archive and Manuscript, the Allen Manson Chesney Medical Archive. The journal of the book, including bibliographies, catalog, history, and bibliography.
Chesney archives also have several strengths in order to keep their records behalf on Johns Hopkins Hospital. They also have a very systematic storage system and also easy to access by the users or the researchers that want to find information regarding to medical schools and also a Johns Hopkins Hospital. But not all of the records are allowed to be accessed by the users because the Chesney archive system only allowed a very certain groups that can be accessed the complete records that kept by their archive. Chesney archives also provides an online catalog that can be accessed through their official website for every users that want to seek an information and want to know the records about Johns Hopkins Hospital. And the record that been kept also always be updated by the Chesney archive staff so that users can be used this access will not miss any information that been stored in Chesney archive. Also made a few mistakes and have their several weaknesses. Regarding to the users, their online catalog are also hard to be accessed and also have a very complicated procedure to access the records online. The online catalog that provided by the Chesney archives are also very complicated to access and require a very complicated procedures to access the records online. The online catalog also provided a very few information about a certain records, and the staff of Chesney archive very rarely to update their online website, so the researcher had a difficult for finding the certain source on Chesney archive website. Other than that, Chesney archives also not very sensitive in updating their information that is available in online platform.
Okay, I will talk about the opportunities and the threats within the virtual visit. Okay, the opportunities that you can get through the Chesney archive, which is the information was up to date, the information is easy to gain, and you can access the Chesney website anywhere. So we talk about the first point here, which is the information were up to date. The Chesney archive information is also talk about the information that about the COVID-19 pandemic that we also going through right now. That's why the Chesney archive opportunities is the up to date to the information nowadays, and the information easy to gain, which is here you can see with a single click on it. Also you can search through the keyword of the information that you want. Also you can search by the categories of the information that you want. That's why it's easy to gain the information. The accessible anyway, which is here mean you can access to the website anywhere, which is right now we can go out, we can go to the cyber cafe or the libraries to gain the information. So we must stay at home, and the Chesney archive website can be accessed through the home. The threats that we can get within the digital archive here is easy to be hacked, cannot be reached when the connection were poor, and the maintenance take a couple of hours before we can use the website. So the first point here is easy to be hacked because of the people that work at the archive services is a lack of knowledge in the technologies. They were referring to the traditional ways, which is hands-on skills. So that's why maybe it's easy to be hacked because of lack of knowledge to do the security, to make sure the security in the archive digital is good enough. So the second point is cannot be reached when the connection were poor. So for example, at my place the connection were interrupted when the heavy rainstorm, thunderstorm and windy days that interrupt the internet connection. So when the internet connection were interrupted, I also cannot get to the internet itself, and you cannot also access to the Chesney archive website. The maintenance also take a couple of hours before we can use the website. Here mean the maintenance of the Chesney archive take a long time to do, because they were updating the information, also updating their security. That's why sometimes it take an hour and 1 hour to do the maintenance. Sometimes it take 2 hours and 3 hours also before we can use the maintenance. So that's the threats that can be had within the digital archive.
In conclusion, the Chesney archive brings many advantages for Johns Hopkins community and general public. Archives are really important as an evidence in the future. This is to make sure the archive to be the center of research in the present and future. The digital or medical website really helps users to have access anytime they want. We hope that archivists can improve so many people can depend and be rely on for the website for reaching materials because of the potential protection of the community information output are being safeguarded. Thank you.